This case illustrates the use of the guide-right protocol to replace maxillary lateral incisors. The diagnostic and the surgical guides were made with Triad gel, which is no longer available and is now replaced with the Primotech products. The first step is to fabricate the diagnostic guide. We're making a vacuform of the cast with a temporary partial indenture in place. The vacuform shell is placed on the cast with the teeth missing, and holes are drilled through the cingulum area of the shell into the cast. A 3/32 drill is used to place the planned implant axis in the cast. The holes in the cast represent the axis of the planned implant osteotomies. A 30mm guidepost, which is 3 millimeters on one end and 3/32 on the other end, are placed in the holes in the cast. 3mm guide sleeves are placed over the long guideposts. The cast is lubricated, any undercuts are blocked out. Triad gel has been added to form the initial diagnostic guide. The guide is placed in the patient with cotton rolls between the guide and the lower teeth of the lower arch. A panoramic view shows the long axis of the guide sleeves in the horizontal plane. When virtual implants are placed, they do not align with the long axis of the guide sleeve. Therefore, corrections must be made. Alignment evaluations are made with the CareStream software. The arch alignment indicator is placed directly over the openings of the guide sleeves. Each site is evaluated in both the buccolingual view and mesial distal view. The green line drawn through the long axis of the guide sleeves indicates it is too far palatal. Using the software, a virtual implant is placed in both the mesial distal and the buccolingual view. The long axis of the virtual implant is indicated with a blue line. The linear correction of 1 millimeter is indicated with a yellow line. And the angle correction of 10 degrees measured with the angle tool is indicated in red. In the mesial distal plane, a 7-degree angle correction is needed to correct the long axis of the implant. The first correction is a 1 millimeter offset guidepost is 10 degrees palatal. The second correction or bend is 7 degrees toward the mesial. Next, the implant in the number 10 site will be evaluated and corrected. A green line is drawn between the long axis of the guide sleeve and the underlying alveolar bone. A virtual implant is placed in the appropriate site. The green line is drawn through the long axis of the guide sleeve. The blue line is drawn through the long axis of the implant. the angle measurement between the two forms is 12 degrees toward the palatal, and the yellow line indicates the level of the correction being made. The second correction for the implant and the number 10 site is the angle correction 5 degrees toward the distal. Again, the long axis of the implant in blue, long axis the glide sleeve in green. The correction is made by placing the guide post in the stylus and tightening the set screws. The set screws in the stylus are tightened with a 0.035 hex driver. For review, the steps used to make the initial correction are reviewed here. Here is an overview of the compound bend. First in the buccolingual plane, second in the mesial-distal plane. After both corrections are made, we are ready to fabricate the surgical guide. The lower parts of the two-piece guidepost are correctly bent and then placed in the cast. The top half of the two-piece guidepost is placed over the bent lower parts and placed back in the cast, oriented with the buckle facing the buckle surface. Triad gel is added to capture the cleat on the guide sleeve and the adjacent lingual and occlusal surfaces after the cast has been relubricated. The surgical guide, after it is corrected and made, should be checked to see that acrylic does not extend over the openings to the guide sleeve. If it does, it must be removed so that the drills passing through the guide sleeve do not result in acrylic pieces being placed in the osteotomy. The cone beam X-ray has been taken to show the placement of the implant after the surgical procedure is completed. Cone beam X-ray image of the number 10 site also shows the placement of the implant. This is the series of the 3.9 millimeter 2 degree tapered drill stop drill sets that were used to place the implant after the osteotomy is completed. A few months later, after stage 2 surgery, the ISQ values were measured at about 75. 3 millimeter healing abutments are placed on the implants. The temporary partial denture is reinserted. Radiographs were taken at the time of the impression to ensure proper impression coping seating and after the final cementation. This is a photograph of the final restorations on the master cast. Zirconia abutments are placed next. Final restorations are placed. This is a list of the guide ride components used in this case.